The thing is, the industry knows that the most important thing is education and training and of caregivers. I am probably the only supplier that includes instructions for how to teach a person how to be a basic caregiver and how to prevent pressure injuries. I don't just put instructions on how to use my product. I put instructions on how to stop bed sores. Pamphlet, the booklet that I includes information about equipment and supplies, and I do use brand names where appropriate. And I even tell them where to go and how much to spend in some cases, because there's a lot of different variations in prices. But my discharge instructions are more comprehensive and more direct than any of them. I don't sell these products. I just tell them what's going to work the best. And that's what people need. I think industry, that's another thing. I step out of the box. I don't follow a paradigm about that, because I think we're doing our patients an injustice when we discharge them and tell them to turn every 2 hours and use pillows or wedges, but we're not going to tell you what to use, and we're not going to tell you why, because it's some kind of conflict of interest. Nobody can by themselves turn a patient every 2 hours, and they sure can't do it with pillows. They are like, you're like throwing a guppy in the sea of sharks when you don't tell them where to go or what to buy, you know? And I'm the only person that's willing to tell them that. There's no profit to that. My success is my customer's success, if you will, my customer or my caregiver's success. So I have everything to gain by telling them exactly what to get and where to get it.